They are not just talking about throwing millions of children and others off of the health insurance they have. They are also talking about cuts to community health centers, which receive about 43% of their funding from Medicaid, and where millions of seniors go to get their primary care. So cutting Medicaid impacts primary care.
Millions of seniors across America are deeply concerned about their future. With proposed cuts to Medicaid and Social Security, access to essential healthcare and financial security are now at risk. So, what exactly is happening in Washington, and how will it impact older Americans? Senator Bernie Sanders is raising the alarm about proposed budget cuts that could strip billions from Medicaid, one of the primary sources of healthcare funding for low-income seniors and people with disabilities. Nearly half of all funding for community health centers comes from Medicaid, and these cuts could have devastating consequences. But it doesn't stop there. Social Security, a program that has provided financial security for retirees for over 80 years, is also facing challenges. The Social Security Administration is already struggling with staff shortages, leading to long wait times and delays in disability benefits.
They are also talking about cuts to community health centers, which receive about 43% of their funding from Medicaid, and where millions of seniors go to get their primary care. So cutting Medicaid impacts primary care at a time when the Social Security Administration is already understaffed. And again, for years, I have been hearing in my office, I expect other senators have been hearing in their offices from seniors who tell us they're calling up Social Security, they've got a problem, they are not getting a response. And the result of that is that some 30,000 people a year die waiting for their Social Security disability benefits. And in the midst of all that, in the midst of a crisis where Social Security is understaffed, where our response should be to significantly increase staffing so that Social Security can better respond to the needs of our constituents, we have Elon Musk and his minions at DOGE cutting some 2,500 of Social Security staff, and incredibly, they are now threatening to cut up to half of Social Security Administration staffing.
Recent reports indicate that nearly 30,000 people die every year while waiting for their Social Security disability benefits to be approved. And instead of expanding support, there are now discussions about potentially slashing Social Security staff by up to 50%. The idea that Social Security is running out of money is simply not true. This program has never missed a payment to eligible Americans, and it remains one of the most successful government initiatives in U.S. history. But deliberate efforts to underfund and undermine it are creating unnecessary panic. Meanwhile, nearly 23% of seniors in the United States are living in poverty, a rate significantly higher than that of other wealthy nations. In comparison, Norway has just 4% of seniors living in poverty, while France sits at 6%. For a country with more billionaires than anywhere else in the world, why are so many seniors struggling to afford basic necessities? Senator Sanders and other lawmakers believe that instead of cutting essential programs, the U.S. should be expanding Medicare to include dental, vision, and hearing benefits, services that millions of seniors currently lack. Right now, over 26 million seniors have no dental coverage, leaving them vulnerable to severe oral health problems. Nearly two-thirds of seniors over the age of 70 experience hearing loss, yet less than 30% have ever used a hearing aid due to the high costs. And for those with poor vision, untreated eye conditions increase the risk of injury, cognitive decline, and depression, yet many cannot afford routine eye exams or glasses.
According to the Organization for Economic Cooperation and Development, we now have the dubious distinction of having one of the highest rates of senior poverty compared to other wealthy nations. In America today, according to the latest OECD estimates, 23% of seniors are living in poverty compared to just 4% in Norway, 6% in France, and 11.5% in Canada. Yeah, we have more nuclear weapons than any other country. We have more billionaires than any other country. But we also have one of the highest rates of senior poverty of any country on earth. We might want to get our priorities right. To substantially improve the lives of our nation's seniors by expanding Medicare to cover dental, vision, and hearing benefits. Its inception 60 years ago, Medicare has failed to cover such basic health care needs as hearing, dental care, and vision. The result, millions of senior citizens have teeth that are rotting in their mouths. They are unable to hear what their children say or unable to read a newspaper because of failing eyesight. Mr. President, this is the United States of America. We are the wealthiest country in the history of the world. Senior citizens should not be walking around with no teeth in their mouth. They should not be unable to hear conversations. They should not be unable to afford glasses so they can read a newspaper. The need to expand Medicare to cover dental, hearing, and eyeglasses is absolutely critical. Nobody denies that oral health, hearing, and vision are essential parts of health care. We cannot continue to deny seniors these basic health care benefits. Mr. President, we can no longer tolerate the fact.
To address these urgent needs, Sanders and several co-sponsors have introduced legislation that would expand Medicare to cover dental, vision, and hearing services. But how would this be funded? One proposal would allow Medicare to negotiate prescription drug prices, something that the Department of Veterans Affairs already does successfully. By adopting this approach, the U.S. could save more than $800 billion over the next decade. Additionally, lawmakers point to waste and fraud within private Medicare Advantage plans, which have been overcharging the government by an estimated $83 billion per year. Cracking down on these overcharges could help fund expanded benefits for seniors. With the future of Social Security and Medicare at stake, the question remains, will Congress take action to protect these essential programs, or will millions of seniors be left behind? What do you think? Should Medicare be expanded to cover dental, vision, and hearing? Share your thoughts in the comments.